Israel Hilton is he's 49 years old. He's worked his entire life in retail customer service and couldn't get health insurance through his job. He makes his income last year was $13,334. He lives in Texas. Now, $13,334 is too little to qualify for Obamacare. And the way that to buy health insurance on the exchanges, to get a subsidy. If he'd made $17,000 a year, he could have gotten health insurance for free. With Obamacare, I believe it was 17 is the beginning point. Might be a little bit higher. And you'd get a subsidy from the federal government, and he would be buying it from, Blue Cross or Aetna or whatever on the exchange in Texas. And if he made under $2,000 or under $3,000 a year in Texas, he could qualify for Medicaid that's paid for in part by the state, 56% by the federal government and 44% would that be, I think, by the state. But instead, because he makes $13,334, and Rick Perry, the governor of Texas, said, we're not going to take the Medicaid expansion from the federal government, an option that was provided to him by John Roberts in the U.S. Supreme Court when Republicans petitioned the Supreme Court to knock down Obamacare. Because of that, he was caught in the donut hole. He can't afford health insurance. He's making too much to get the health insurance for really, really, really destitute people, the Medicaid program. The state did not expand the Medicaid program for Obamacare, and he doesn't make enough to qualify for Obamacare. And he has been diagnosed now with terminal brain cancer. And the doctors are saying, he'd been having these headaches. He just didn't go to the doctor until finally the headaches turned into seizures, and he was afraid to go to the doctor because he didn't have insurance. When they became a seizure, he ended up in the ER, and that's where he was diagnosed. Oh, and first the neurologist said he had depression and sent him home. Seizures stopped for a while, then they came back with a vengeance. He finally goes in. He has no choice. He's having seizures. He's taken to the ER, and they scan his brain, and okay, this guy's got 18 months to live. The doctor said, if we actually treated him earlier, if somebody diagnosed him, he might be alive. But he didn't have health insurance, so he really didn't have that option. And he did go to the ER, and they did say, well, sorry, it looks like you're depressed. See you later. So why would Rick Scott turn down this money, and why would anybody think that this is not only a good thing, but a moral thing to tell Israel Hilton, just go die? Ed Haislmaier is with us. He's a senior research fellow with health policy studies at the Heritage Foundation, heritage.org. And Ed, welcome back to the program.
Thank you.
I think this puts you in an odd position because Obamacare, complete with the Medicare expansion, was first created by you guys, was it not, Heritage?
No. No, not at all. What they did was they took some of the concepts and reworked them. And it's kind of like, I like to tell people, it's kind of like giving your wife or your girlfriend a box that says Tiffany on the outside, but there's actually something else inside it that Tiffany didn't make. So,
okay, something from Walmart.
They try to claim, but for example, the exchange, that was designed to create defined contribution, multiple choices, lots of variation for people who are stuck in one-size-fits-all employer plans. Instead, they're using it to reduce choices and access. But anyhow, that's be that as it may. Talking about the Medicaid expansion, why expand or why not expand? It was interesting. The story you were relaying. Individual.
This is the red state donut hole. You have 25 states where Republican governors or legislatures have created this red state donut hole.
Well, they haven't created it, first of all. The law creates it. Secondly...
John Roberts.
Well, okay, one can argue that
the Supreme Court created it.
Well,
but governors have the choice of having it in their state or not having it in their state.
That's right.
And Jan Brewer, the Republican governor of Arizona, said, I don't want this donut hole in my state.
Well, it's very interesting. The reason Arizona, and I was not surprised that Arizona adopted it, Arizona actually did this, extended coverage to this population on a waiver before the passage of PPACA, and had 10 years experience with it, and so it would be one of the few states and the administration wouldn't play ball and let them continue that without adopting the expansion. So they were forced into a situation where they either had to adopt the expansion or throw people off the rolls that were already on.
So, but bottom line, Ed, how is Rick Perry in turning down? First of all, in not allowing Texas taxpayers to have their own money back from the federal government.
Okay.
How is he not either complicit in murder or malpractice?
It's not murder and
or malpractice.
First of all, let's remember also here what's going on. I mean, the individual you're talking about, if that individual is single, they would qualify for exchange subsidies because the federal.
He's married with children.
Okay. Well, then for a few more dollars of income, they might qualify.
Yeah, if he was making $16,000 or $17,000, he could have had Obamacare. But
right.
But this is the problem of these people who are the working poor.
Here's the interesting thing that's going on here. Keep in mind that he is not representative of this population. In other words, when you look and you say, who will be added to the Medicaid rolls? Is it kids? No, they're already on to that level. Is it disabled? No, they're already on. Is it the elderly? Is it pregnant women? No, they're already on. The people who will be added to the rolls are able-bodied adults. Now, this is important, and furthermore...
Like Israel Hilton.
Right. And furthermore, but unlike this gentleman... between three-quarters, actually, even in poor states, at least, because I was just in Arkansas, at least three-quarters of those people do not have dependent children. In other words, they have low incomes, but they're able.
So we should just say, screw them, let them die.
No, nobody said that. Remember, keep in mind what's going on.
Well, that's what Rick Perry's saying.
No, that's not what he's saying.
It's absolutely what he's saying.
No, come on, you know better than that.
No, I'm telling you, I'm drawing a moral line in the sand here. Rick Perry is either committing murder, or he is the worst governor Texas has ever had, and he should be impeached.
I know you have an ideological agenda, but let's stick to
this. Is not ideology. This is a man dying because this governor chose this policy.
Let's stick to the facts here. The facts are that going back a couple decades to something called EMTALA, the Emergency Medical Treatment and Active Labor Act, hospitals cannot turn people away at the emergency room. So, as you pointed out, this gentleman
passed during the Reagan administration, but they don't have to provide them with anything other than triage.
No, they do. They have to provide them with more than triage. And furthermore, and this is very important,
this brain cancer was diagnosed in the emergency room, and the hospital said, we can't treat this. This is not...
That hospital may not be able to, but some other hospital might. Now, furthermore, here's the other point. We have been...
This is your solution?
No, I'm just telling you, people get the medical care and it gets paid for. That's the point I'm trying to make. People today who are uninsured and have medical problems, they don't necessarily get it timely, and that's a problem, and they don't necessarily get the best. That's also
this is absurd. If this guy had Obamacare and he had gotten treated early, instead of it being a very expensive...
That's the other problem. But the point is, in this situation, we already are spending hundreds of billions of dollars on hospitals to cover the cost of care for gentlemen like this. The point that I was going to make is, though, the vast majority of the people who would be added to the rolls by Medicaid are not only able-bodied adults, but they do not have dependent children, three-quarters of them. Half of them are between 19 and 34. Now, the interesting thing about this is you saw the report that came out from the Congressional Budget Office last week. In fact, I'm writing something on
Ed, we're just about out of time. You got to get to your point.
The point is that CBO says if the state does not expand Medicaid, those individuals will have an incentive to work more to get on Obamacare subsidies. If they do expand Medicaid, they'll have an incentive.
So what Israel should have done is he should have worked extra hours to get his income from. He should have taken a second job.
Well,
this is all his fault.
No, it's not his fault. The point is, you can find a solution for him without adding hundreds of thousands of able-bodied young adults to the rolls in the process.
Okay, Ed, you got the last word. Hang on just a second.
This is the Thom Hartmann Program.
Ed Haislmaier, Senior Research Fellow with Health Policy Studies at the Heritage Foundation, heritage.org. Ed, thanks for being with us today.
Thank you.